Greetings, ladies and gentlemen. My name is Dr. Cadet, infectious disease specialist, and I'm here to talk to you about some of the updates on COVID-19, where we at as of October 24th, 2020. Let's go. And as of October 2024, as of October 24th, 2020, globally, there are about 43 million cases confirmed with over a million deaths. That is really sad. In the US, there are over 8 million cases with about 225,000 deaths. States or places that are more active in terms of COVID-19 include Texas, with over 907,000 cases and 18,000 deaths. California, more than 901,000 cases and 17,000 deaths. Florida, we have almost 800,000 cases and over 16,000 deaths. The major cities or counties with the most cases include Miami-Dade County, 182,000 cases and over 3,600 deaths. Broward County, over 83,000 cases and close to 1,600 deaths. Palm Beach County, greater than 50,000 cases with almost 1,600 deaths. Hillsborough County, we have close to 47,000 new cases or 47,000 cases and 760 deaths. Orange County, about 45,000 cases and 545 deaths. To take a look at the new cases by day and the death by dates, for the last 3 days, starting October 21st, there were about 4,000 cases in October 21st, October 22nd, about 3,700 cases. In October 23rd, there was up to 4,000 cases. Now, the death by dates, the last 3 days, for October 21st, there were about 9 deaths. October 22nd, 6 deaths. And October 23rd, about 4 deaths. Now, there are some persistent symptoms in COVID-19 patients that we need to keep in mind. Some of the symptoms include fatigue, breathlessness or shortness of breath, cough, loss of smell, loss of taste, lack of appetite, muscle aches. And those symptoms actually, they tend to stay with you even post-COVID. About 60% of those patients continue to experience the same symptoms, unfortunately. That's where it is important to wear your mask, practice social distancing, and the washing of hands. What are some of the risk factors for COVID-19? Well, risk factors for COVID-19 include older age, COPD, chronic obstructive pulmonary disease, severe asthma, cardiovascular disease, type 2 diabetes, obesity, sickle cell disease, chronic disease, immunocompromised state from solid organ transplant. Possible risk factors include um, pregnancy, other immunocompromised states such as HIV, and of course, we have disproportionate burden of COVID 19 among racial and ethnic minorities, the Native Americans, and the poor. Now, let's talk a little bit about the fundamental for prevention of acquisition and transmission of SARS-CoV-2. It is really important to be aware of those measures. According to Dr. Fauci, infectious disease physician, there needs to be universal wearing of masks and uh, face covering, maintain physical distance at 6 feet or 2 meters, avoid crowds and congregate settings. Outdoor activities are actually better than indoor activities. So for the season between October and December, please, please, ladies and gentlemen, it's better to do more activities outdoors than indoors. Unfortunately, with the cold weather, there may be more activity done indoors, but be safe, wear your mask, practice social distancing, and of course, frequent washing of hands. Now, I want to give you this illustration where when you have no mask and you breathe, you are breathing, that will contribute to the spread of the COVID 19 or the coronavirus. Now, if you have a mask, you talk and breathe, the virus may be contained, as opposed to having a mask and coughing. If you have a mask and you're coughing, now the virus may be spread. So it is really important to practice social distancing in addition to wearing your mask. Now, I want to talk to you about those two things, uh, how you choose your mask and what kind of mask not to wear or not to choose. Do choose masks that have two or more layers of washable, breathable fabrics. And number two, completely cover your nose and your mouth. Number three, you got to fit snugly against the sides of your face and don't have gaps in them. On the contrary, do not choose masks that are made of fabric that makes it hard to breathe, for example, vinyl. Do not have exhalation valve or vent, which allow the virus particles to escape. And also, masks, do not choose masks that are intended for healthcare workers like the N95. So they can use those masks. And be careful with the gator neck or the neck gaiters and the mask made of polyester and the mask made out of handkerchief. Those are not effective masks. And also, when you have the face shield by itself, that may not protect you. What about special populations like children? If you are able, you need to find a mask that's made for children. If you can find a mask made for kids, check to make sure the mask fits snugly over the nose and the mouth and under the chin. Do not put a mask on children younger than 2 years old. Some children are able to tolerate, but some are not. What about special circumstances for people who wear glasses? If you wear glasses, find a mask that fits closely over your nose and one that has a nose wire to limit fogging. How not to wear your mask. This is very important because COVID-19 is going to be with us for a while, and we have very few weapons that we can use to fight COVID. So listen up. How not to wear your mask. Please, please, please do not wear your mask around your neck, on your forehead, under your nose, uh, only on your nose, not appropriate, on your chin, and with the mask dangling from one ear or on your arm. That's not acceptable. Now, how to take off your mask. Number one, carefully untie the string behind your head or stretch the ear loop. Number two, handle only by the ear loop or thighs. Number three, you need to fold the outside corners together. Number four, be careful not to touch your eyes, nose, and mouth when removing and wash the hands immediately after removing the mask. How to clean your mask. The mask should be washed regularly. That is the cloth mask. Always remove mask correctly and wash your hands after handling or touching a used mask. Now, um, when it comes to mask, you got to really be careful and be conscious of mask. A lot of people say they don't like mask. So actually, some people say they don't like mask because they don't work. But science states that wearing mask and social distancing actually slow the COVID-19. Scientific evidence is clear. Social distancing and wearing masks actually help prevent people from spreading COVID-19, and masks also protect the wearers from being infected themselves. So when you wear a mask, not only you protect yourself, you also protect others. So it's really important to wear a mask and choose them appropriately. For example, where you see green, those are decent masks. Uh, number number three on top, number four is good, number seven, good, number 10, 13, 5, 8, 6, 9, those are green check, those are good masks to wear. Now, keep in mind that according to CDC and according to scientific studies, it is really important to wear a mask and social distance when you're in public setting, like in public situation and mass transportation, like when you're taking city buses, at events and gatherings, parties, and anywhere you will be around people, at churches and bars. Very important to wear your mask and social distance at least 6 feet. In summary, the truth is that masks work and are very important. There should be no question about whether you wear a mask at this time, because currently we have over 80,000 new cases in the US. That is amazing. That is really sad. Everyone should wear a mask. People who say, I don't believe masks work, are actually ignoring scientific evidence, and it is selfish attitude, selfish posture to take. Let's all do our part to stop the spread of COVID-19, ladies and gentlemen. And if you want to check your status or if you've been exposed, you can check at Barnett Park, and you can call. The phone number is actually 407-436-3111. You can also check at the community health centers on Mercy Drive, phone number 407-905-8827. You can go to the convention center. Address is 5980 Destination Parkway, zip code 32819. And the True Health System, you can go on Lake Eleanor. You can also go on Lake Underhill, 5730 Lake Underhill, and also 11881 East Colonial. You will get tested there. And the phone number is 407-322-8645. You can get tested. And if you live in Kissimmee area, you can go to the Main Gate Complex in Kissimmee, address 3010 Main Gate Lane, Kissimmee, Florida, 34747. Now, how to reach me? You can visit my webpage, and the address is https://cadets.solutions/ or you can visit my Facebook and Instagram pages. by typing Francoeur Cadet. And you can subscribe to my YouTube channel if you want more educational videos about COVID, about breast cancer, about hypertension, diabetes. And of course, if you don't have a medical home, you can reach us as well at the Orange Blossom Family Health on 232 North Orange Blossom Trail, Orlando, Florida, 32805, and we will care for you there. Thank you very much. Be blessed and be safe. Ciao.